Good afternoon, renowned R members. Welcome to this meeting of the Social and Healthcare Overview and Scrutiny Committee. I think we've got a couple of apologies and substitutions today on the first agenda item.
Thank you, Chair. We've had two substitutions, Councillor Debbie Owen for Councillor Steve Coppell and Councillor Sean Bibby for Councillor Gina Madison. Thank you, Chair.
Thank you, Margaret. And agenda item 2 is declarations of interest, including any whipping declarations. Would any members like to make any declarations?
Chair?
Yes, Councillor Healy?
I just want to let you know I have to leave at 4 o'clock.
Okay, thank you for letting me know, Councillor Healy. I don't see anybody else indicating for any declarations, so we'll take that nobody has any. Agenda item 3 is the minutes of the previous meeting, which was held on the 23rd of October, and they're on pages 5 to 8. So would any members like to make any comments or move those as a correct record? They've been moved by Councillor Coggins-Cogan and seconded by Councillor Claydon. All those in favour? That's unanimous. Thank you all. Agenda item 4 is the... Sorry, Craig.
Sorry, Chair, can I just come in? So in the minutes, members will see and recall that at our last scrutiny, we considered a paper which provided an overview of the CIW Care Inspectorate Wales inspection of children's services in July this year, and it included the identification of an action plan. So there were areas of improvement that CIW noted that needed to be taken forward, and we set a detailed improvement plan that was considered by scrutiny. In line with normal process, that report was presented to the Corporate Audit and Governance Committee on the 24th of November. Just for transparency and to ensure that scrutiny are cited, Governance and Audit Committee considered the report and considered the action plan. They felt that the covering action plan didn't fully identify and reflect the full areas of improvement that CIW had identified. However, I did explain that we had the comprehensive action plan that identified every single improvement contained in the report and set out the action that we were taking. The committee considered the report, but they felt that they wanted, from their perspective, to have a differing recommendation in relation to the report through their scrutiny overview and cite. I'm just pulling up their recommendation. So what that committee recommended was that CIW improvement check found a mixed picture with areas of improvement alongside important concerns that require attention, and that it welcomes the commitment of the portfolio's leadership, practitioners and staff in addressing the concerns raised. So they retained some of the recommendation of scrutiny, but added to that recommendation for that committee. I just felt it was important that people were cited on the debate and discussion that happened in audit and governance. I don't think you need to take any action, but for transparency, I felt it was important that feedback. And certainly we will give our undertaking, because we'll be reporting progress on that report, and we'll ensure we're more explicit in the covering report. Thank you.
Thank you, Craig, and I'm sure we can take a note of that on behalf of the committee. So forward work programme, agenda item 4, Margaret.
Thank you, Chair. So our next meeting is at 2 o'clock on the 15th of January, and we've got several items on that agenda. There is possibly going to be a change for the framework of support that may well move to the February meeting, but that's yet to be confirmed. So we've got a few items on for the February meeting. That again is a 2 o'clock meeting, but just a heads up about the March one. That is at 10 o'clock. I know we are used to having our social and health meetings at 2, but the March one will be at 10 a.m. So the social work programme is there in front of you. If you have any comments, then do please let me know. We have an indicator online, Chair, Councillor Robertson.
Councillor Robertson.
Thank you, Chair. And can I first thank you for allowing using your discretion to allow me to speak as not a member of this committee. I was contacted by a resident of my ward recently who had applied to Care and Repair for aids and adaptations and was delighted with the service that he received and can't speak highly enough of them. There was one issue, though, where a particular adaptation he asked for, and Care and Repair said that they couldn't do it because they could only provide aids and adaptations that were specified within the contract with Flintshire. Now, they thought that what he was suggesting was sensible, and he subsequently had it installed at his own cost by another provider, and he's very happy with it. I've been around to see it. I think it makes sense. But I wonder whether the committee might wish to consider to review the contractual arrangements with Care and Repair and see whether a sort of common sense approach to things not specifically listed could be put in place for future. I wonder whether the committee might wish to consider that either in the February or the March meetings.
Thank you, Councillor Robertson. I'm just going to pass over to Karen Chambers.
Thank you, Chair. The relationship that the local authority has with Care and Repair is both through the Social Services Department and also colleagues within the Housing Department as well. Without wanting to distract too much through the detail of that, I think it's important to say that the general principle is that we adopt a principle whereby we support with the provision of a certain amount of equipment to meet some core aims, and then we do work with individuals where they've got needs that extend beyond that, and that's very much around our models of care and support, which works with individuals to also provide some level of self-help. Now, from a perspective of what an individual should be able to gain via a contract, I would anticipate and expect that on individual circumstances, if Care and Repair or other providers did feel that there was a piece of equipment that we could be considering, that they could come back and have conversations with our occupational therapy team, for example. So I think we do need to think in a flexible way, but there are also some restrictions that we do need to have in place. It's the same with our provision through the New Seas, which is the North East Wales Community Equipment Service. Not every piece of equipment is provided by Flintshire County Council. Some pieces of equipment are also required to be self-purchased. So without knowing the specific details of this case, Councillor, I think I'd like to assure you that we do regularly review what we do provide as core and what we don't, and the implications that would have on individual residents. But as always, if there's individual cases to be explored and discussed, we'd be very happy to look at that as well. Thank you.
Councillor Johnson.
Point of order here, to be clear, that this morning when I was on Education Committee, chaired by a member of your group, James, quite incidentally, I was told that I was not a member of the group and therefore eventually I was allowed to come and speak. I'm just wondering, this is the Scrutiny Committee for Scrutiny members, and what the actual rules are of members who are not part of the Scrutiny Committee asking scrutiny questions, and whether these questions that are being put forward here will be best written as an email or whatever to the chief officer or yourself and then taken up, rather than, because what's the point of having a scrutiny committee where anybody can turn up? We choose members to go on the committee, and it's for the committee to hold officers to account, not members who turn up. Thank you.
Thank you, Councillor Johnson. My understanding is that it's the Chair's discretion whether to allow non-members of the committee to speak, and I've always taken a view that non-members are welcome at the committee both to attend and to speak and to contribute. So I'm not sure there's been any breaking of the rules or anything in relation to that. And as I say, I'm reiterate that I'm happy for any member to attend these meetings and to contribute. Obviously, I would generally give preference to members of the committee if they want to speak first. But I think maybe as a first step, it might be worth Councillor Robertson be getting in touch with Karen and discussing potentially that particular case. And then if it's something that the committee wants to look into, if you aren't satisfied with that, then perhaps we could do it at that point. Councillor Jones.
And thank you, Chair. Yeah, and if anybody's ever got anything at all, they can email me with any question, and Councillor Ibbotson could have got in touch with me, and I can then speak to the officers. Always available.
Councillor Robertson, does that satisfy you as a path forward in the short term?
Yes, the specific adaptation was a particular type of grab rail. Apparently, some grab rails allowable, some aren't. And so I think that there's obviously, there is no specific casework here because the resident has sorted himself out. And so, but it's the general principle that might be of interest to the committee, and the resident was quite keen that some visible action be taken on his behalf in order to ensure that this doesn't affect other people in future, hence the bringing it to this committee. As I say, it's entirely at the committee's discretion whether they wish to take it forward or not.
Thank you, Councillor Robertson. Would any other members like to put anything forward for the forward work programme or have a view on Councillor Robertson's suggestion?
Chair, can we clarify this? Is this again with the protocol? You did say it would allow members to go and speak on this. Does that extend to members being able to make proposals to go on further agendas, even though they're not a member of the committee? Because I think isn't that taking a step forward? To make a question that's legitimate, as you go and say, but therefore, is it legitimate that members who are not on the committee go and make suggestions to the committee? I'd be grateful for guidance from Democratic Services as well.
Shall I come in?
Yeah, I mean, my understanding is that it would need to be a member of the committee that would make that as a suggestion, that Councillor Robertson wouldn't be able to. Hence why I asked the committee for their view on that. I don't know if Margaret wants to add to that.
Yeah, I think any member of the council can put forward items for the forward work programme which they think is of significant importance to be put forward, because as a committee we do need to look at things that make a difference. So yeah, every member has an opportunity, but it's up to the committee whether or not they want to take that forward in conversations with the chair and the chief officer and his staff to ensure that we are making the best use of our meeting. Thank you.
Councillor Coggins-Cogan.
Thank you, Chair. Yesterday we had a bit of a fractious full council meeting. Full council is inherently political. Groups have a pop at each other. I think maybe today we're sort of starting to bleed over from yesterday's meeting and today. And I think it's, I understand the concerns from the deputy leader, but I think if I was on screen doing what Councillor Ibbotson was doing, I don't think it'd be met with quite the same reaction. So I think, we just need to take a breath and draw a line under yesterday and move on. The scrutiny committees are meant to be apolitical. So yes, that's what I'd say, Chair. Thank you.
So I think the suggestion that to take it forward, if Councillor Robertson is satisfied that, the suggestion that the chair put forward, that you discuss it with Karen, and if you do feel that it still needs to be taken forward, then it could come through the Democratic Services Manager. Is that acceptable, Councillor Robertson? Councillor Robertson appears to be nodding, Chair. Thank you.
Thank you very much. So I'll ask one more time if any of the other members have anything they'd like to put forward before we look to move to the recommendations. Sorry, let Margaret do the action tracking before that.
Okay, so there's nobody else indicating at this point, so we'll just move to the action tracking, which is on page 19. And I'm pleased to report that I think they're all completed, which is good news. And the chief officer, there is one on there, which was the chief officer suggested, advised that the plan was already based on impact and feasibility, and he agreed to give further consideration how the action plan could be made more explicit going forward, and that is on the chief officer's radar. And then the next suggestion, the chief officer suggested an informal meeting with staff who are part of the scheme, and there is a report on the workforce on the forward work programme for March 26, so that will be part of that, hopefully. And so everything else is completed, Chair. Thank you.
Thank you, Margaret. So unless anybody wants to add anything else, we'll move to the recommendations, which are the usual three: to consider the forward work programme, to allow the facilitator in consultation with the chair to vary it, and for us to note the progress made. So do I have a mover for that? Councillor Claydon, thank you. And a seconder, Councillor Bibby. All those in favour? Looks unanimous. Thank you all. Agenda item 5 is budget 2026-27, stage 2. So I think I'll hand over to Chief Officer initially. This we've also got Dave Legend from Finance, and of course the Cabinet Member for Finance is here as well. So,
okay, thank you, Chair. I'll just do an introduction before Craig's going to go through the various pressures. As in past years, the budget for 26-27 is built up in stages. The first stage of that for the budget planning for 26-27 was concluded by the establishment of a robust baseline of cost pressures, together with a member briefing to ensure that all members had a full understanding of the Council's challenging overall financial position. And then in September, Cabinet and Corporate Resources Overview and Scrutiny Committee received an update on the budget planning position, which showed that we had a revised additional revenue budget requirement of 27.45 million. Clearly, this presents a serious and major budget challenge for the Council, and a full set of proposed solutions to bridge this gap are currently being developed and referred to within a Cabinet report within the December reporting cycle. This review by Overview and Scrutiny Committees from the 11th of November to the 4th of December is aimed at scrutinising specifically portfolio cost pressures to provide assurance that they are an essential requirement for the 26-27 budget, and to ensure that there is no scope to remove or defer any of them to assist with dealing with the budget challenge. More recently, the draft Welsh Government budget was announced on the 14th of October, and then the provisional Welsh Local Government settlement was received on the 24th of November. A full update on our budget planning position for 26-27 will be presented to Cabinet and Corporate Resources Overview and Scrutiny Committee in the December cycle, taking into account the impact of the provisional settlement that was released last week. And the report will be in the public domain from tomorrow, in advance of Corporate Resources Overview and Scrutiny Committee next week. The third and final stage, stage 3 of the budget process, will be the identification of the full set of budget solutions required to ensure a legal and balanced budget, and that's set in line with the Council's overall available funding envelope. So now if we move on to the details of the cost pressures for social services, which fall within the remit of this committee, and they're included within the report. The committee is invited to review and challenge these cost pressures and associated risks, and also to consider the actions that have been identified to manage in-year financial pressures in this current financial year, 25-26. So I'll hand over to Craig. Thank you.
Thank you, Dave. There's two elements to this report. The first one is concentrating on the pressures that social services have identified, and they're inviting you to review, challenge and consider whether any of them can be removed, deferred or look at differently. The second element of the report is around the in-year overspend in social services and the actions that we're taking in relation to managing or trying to manage that in-year overspend. But if we deal with the medium-term financial plan and the pressures, there are 10 pressures that have been identified for next year's financial budget from social services. The first one, which is our largest one, is social care commissioning. So if I just explain that, we commission a high percentage of our care, direct care to children and adults from the independent sector. So that covers older people care fees, domiciliary care, direct payments, bespoke care packages for children, and mental health and disability services. What we know is that the cost of care is increasing for providers. So specifically, we know that the real living wage in 26-27, there's an increase of 6.7%. So it will be rising from £12.60 an hour to £13.45 an hour. And in October, the CPI was 3.6%. We know that providers will be looking to, in their fees, increase the fees to cover those costs. And it would be naive and inappropriate for us not to identify that as a real pressure that will come our way from the 1st of April. So it's a big figure because it represents a big proportion of people provided with direct care. Do you want me to pause on after each one for questions or rattle through 10? Okay,
Councillor Mackie.
Thank you, Chair. I think we cover each one as we go through. That would suit me fine.
So unless there's any questions or point of clarification, I'll move on to number 2 or 2. So the second one is...
I did ask the same in education. I'm still not entirely sure I understand. The 4.23 million, that's extra to what you already spend because of the increase of the national living wage, which for the record, I agree that pet carers should be paid well.
And I think it's an important point you make in terms of the question, because that represents the inflationary increase to our current provision. I think the reality is that we know that there is demand growing. So this is a calculation based on what we know as demand currently and our bill and how we think that will increase. Whilst demand grows, obviously some people end care for various reasons. So that's how we come to that methodology.
Councillor Mackie.
Thank you, Chair. I'm particularly paying attention to the item in the first part of the report, which says that we have to make absolutely certain that the cost pressures are real and are necessary. And that's why I think we should go through each of these cost pressures independently, because the members of the Cabinet who are here can know that this committee has diligently discharged that requirement. Yes, it does seem like a lot of money. I would agree with that. But I think we have to recognise that the providers are not in a comfortable position anyway. They've been the amount of money we pay has been constantly put under pressure for years. And my experience some years ago from actually talking to some of them was that they are literally clinging on by their fingertips. We even had a meeting in the old council chamber, this goes back some years now, based upon a report which actually gave details of the really poor financial position of people who provide this care. And I have no doubt at all from what's been said and what I know from the past that this is a pressure which is real and and we're only being asked to provide the minimum. Thank you very much, Chair.
Any other members? Councillor Lister.
Just to completely clarify, the Social Care Commission, it's a statutory requirement of the council. We have to do it, don't we?
So no, we could provide all the care ourselves in-house, and you'll see later on we're looking to expand our in-house offer. And for example, we've just opened T. Croix Atty, and that is an increase in provision in terms of the number of beds. However, what we know is that we don't have the workforce, we don't have the assets to move to provide all of that care ourselves, nor the workforce. So we are reliant on some very high quality commissioned services. We've got a statutory duty to meet the need, and we can do that. There is choice, but we're not in a position to do all of that provision ourselves.
Councillor Johnson.
I just wondering if the Chief Officer could clarify for the committee, is this something which is demand driven, statutory driven, or is it a choice that we have?
So my view on this is that the provider has to pay the real the minimum wage. They have to. The real living wage is an expectation that we pay from Welsh Government. I think that what we want is a vibrant workforce that has fair pay for fair work. And I think as a principle, the council would be supportive of the real living wage. We're not mandated, but we are expected to pay that. I think we then therefore have to expect that if that's what's been paid, then it's incumbent on us to pay our providers so that they're able to maintain as a business. This, as I said, relates to the provision that we are providing now. I think that there is a separate point. There isn't in this medium-term financial strategy any growth for demand in terms of demography, and that might be one of the things, and I know it's one of the things that we are talking about, I'm raising as a chief officer and having discussions, because as you will see later on, we've got an in-year deficit, and that is driven very much by demand. And I think that there's probably a space for consideration around a separate pressure which relates to demand-driven demography, complexity of need, and meeting increased numbers of people who need social care. So that's not what drives this. What this is the actual cost for delivering the care that we provide through the independent sector, and inflation, their bills and wages going up, and then passporting that to us. And then I would suggest there's a separate element that we need to consider around demand-led demographic pressure.
Any other members on the first cost pressure, social care commissioning? No, I'll let Craig move on to the second one.
So the second area is young people with a learning disability that are currently being supported, but they will transition to adult services. And there is a process and assessment, and if you've got questions, I'm sure Claire will be able to help us out in terms of that process. But what happens is, we know as young people transition to adulthood, there will be increased costs as they move into adult services, things like residential college placements. There's a process where we very robustly assess people's needs, what is the most appropriate, cost-effective way of meeting their outcomes. And what we know is that there are identified individuals who will go through that transition process next year, and the cost of meeting those needs. And that is what's reflected in this pressure. So it is known individuals.
Councillor Lister.
This made me think then, as a child transition with learning difficulties transitions to adulthood, they potentially go into independent living or away from the family. Does that cost fall to social services to provide the sheltered housing if the child has learning, or is it absorbed somewhere else?
Sorry, yeah, that would fall to social services to provide that.
Does this figure?
Yes, it does, yeah.
So I don't know if people know Claire, but Claire's the service manager of this area. So I wanted to give her the space to reply. But yeah, it's supporting that transition to adulthood. If we didn't build this in, this would become an unfunded financial pressure for social services next year.
So this 990,000, what does that break down as? Is it an anticipated increase in demand for the service, or is this again pay related?
This is planned. So this is young people that we know will be transitioning into adulthood that we know of so far. Yeah.
22 young people.
Councillor Thew.
I've just wondered what direct payments, direct payments would involve. Everything else is self-explanatory. So if you could explain that, you.
So direct payment is sort of a personal choice of how they want their care and support provided.
Yeah.
Do you want to give an example of a direct payment? So this is people coming into adulthood
Yes.
that can have their care and support met in a different way when they were a child through a direct payment.
It's an assessed need. So the social care assessment will determine what care and support the individual needs, and then we either commission that support or it's via a direct payment. So the person has control and choice and voice over what support they have and who provides that.
Any other members on transition to adulthood? Nope. We'll move on to domiciliary care and reablement.
So one of our ambitions is to increase the offer that we're able to make through our in-house domiciliary and reablement service, particularly focusing on reablement, so that we are the specialist and go-to for reablement, particularly often as people come out of hospital and have that expertise support. Our ambition is to increase our capacity year on year. This pressure that we've put in would enable us to employ more staff to be able to deliver that service. It would enable us to deliver 91 hours additional per week and would save us needing to commission that from the independent sector. So it's that diversion and growth of our in-house provision. Currently, our in-house services cannot meet need. So the number of referrals to our in-house provision exceeds our capacity and ability to meet that need. That is particularly pertinent when we come to hospitals, where someone might be assessed as needing reablement or complex domiciliary care. And the reality is that we're not always able to respond as quickly to that person to enable them to get out of hospital. And we need to invest in that area and build that capacity. I do have to say that, you know, we've had thoughts about, do we go bigger and bolder quicker? But the reality is recruitment is a challenge, and we need to be realistic about our ability, how many people we can attract, recruit and train. So this is something that we see as an incremental position. Our ambition is to increase from currently 25% of all domiciliary and reablement sitting in-house to becoming 30%. That 5% increase would require 520 hours being expanded in-house. 91 is what we think is proportionate and deliverable, though challenging for us next financial year.
So just to ask on that, if the 91 hours is down as a £100,000 cost, to get to the 5% and the 520, you're looking at about £500,000 to get there.
Yeah, we'd need to do it every year because wages go up, etc. But yeah, so this is something that we've had in two previous medium-term financial strategies. There wasn't one last year. We actually deferred it because there were challenges with recruitment. We want to put that in. What we'd be looking to do, Councillor Swash, is see next year how that goes, see what demand is, ensure that we've assessed impact and capacity, and then consider whether we would want to put a further MTFS bid in. At this point, we're not identifying future years, but we want to focus next year and see where that takes us.
Councillor Lister?
I know it's not all about money, I know that, but we are talking about the budget now. What is the cost of care provided in-house compared to the cost of care commissioned?
This is where I wish Jane Davis was with me. I don't have the precise figure and I don't want to give you false information. What we will do is go away and get that. I think for me, what the important bit is that it's not always directly comparable hour by hour, in as much as the space that we are moving to for in-house. My vision is that what we do in-house is support the people with the most complex needs, and that we upscale and develop our workforce so they have the competency, skills and support to be able to do that, because that maximises what we deliver and get. Now, to compare the annual hourly cost, you also have to take into account the complexity of someone's needs and what it is they're providing. So we can provide the hourly rate, but it's not always a direct comparator, because actually the skill set and the training and the support that someone needs to deliver and support someone complex needs might not be at the same level, and the overheads associated with that, with delivering, I want to say routine, but I don't mean that, but more kind of, yeah.
Is there a difficulty in commissioning care that is that high level need? Yeah, so we need to do it here.
Yeah, what we know is that there can be challenges in commissioning workforce to meet complex needs, but also there are geographical areas where there is very few provision, and that they're the spaces that we absolutely need to expand. So Karen's going to come in because she's got some.
Thank you. Just to add as well, I think it's about the agility. So the geography and the complexity are certainly part of the situation that we arise, but actually our approach, reablement approach, for example, may mean that 1 week you're going in and providing one level of care, then you're reducing it, then you might need to increase a little bit. And actually that's really quite difficult from a rotoring and from a business continuity and a staffing perspective. But actually that's really what we need, because we need to be able to flex our care provision to the need and not set it in stone. So one of the areas that we want to be able to really work towards developing, and I think in-house gives us maximum opportunity in the shorter term to do that, is that agility. So I think that was just worth adding, because it's a real part of the complexity of meeting needs. Thank you.
Just on the issue of thinking about it as if it's come here as a cost pressure, particularly in relation to reablement, is it not the case that by not making this investment now, that there's potentially a bigger cost to the council further down the line? So although it is down as a cost pressure, this is one of those examples that could be seen as more of an investment.
Later on, we'll be looking at the action plan for in-year savings, and one of the pieces of work that we've been doing is understanding the impact and benefit of reablement. What we are seeing is more hours reablement, more people going through reablement, and a greater upfront cost, which is impacting on our in-year budget. However, what our data people and our finance people have been doing is tracking the longer term outcomes, and that's definitely showing a reduction once people have been through a reablement on long-term care. So absolutely what you're saying, the data and finances support that model.
Shall we move on to expanding grow your own social carers and occupational therapists?
This links very much to the challenges that we've had around recruiting social workers and OTs and retaining them. We have a programme which is around growing our own staff. So that often is we have people that work for us for a while, get some really good skills at supporting residents, whether that through assistant posts that support both social workers and OTs, and then there is a programme where they can apply to step on to the OU courses. It's been really, really successful, and I think what you asked for last scrutiny is when we do our report on workforce, we bring some of the people who've been through this scheme to come and tell you their experiences. The reality is, if we didn't do this, we'd be even more reliant on agency social workers. What we see is not only people, if someone is sponsored through the scheme, we enter into an agreement with them, which means if they left the authority within so many years, there's a tapered repayment that they have to do because we've invested financially in their career development. But what we see is, on the whole, people who go through this process end up as very long-term employees. You create that psychological contract where we've invested in them. They've committed to Flintshire and stay with Flintshire. I'm just looking at Kathy, because one of your managers was a Grow Your Own Wes, wasn't he? So we have people that then have moved into management positions. So I would contend it's definitely worth, we talked about last time, invest to save. This is a very strong invest to save. It's much cheaper and much better than relying on agency staff.
Councillor Mackie.
Thank you, Chair. There is a shortage of social workers. There's no doubt about it. It's a fact. If we don't do something to change that, i.e. we don't try and bring our own social workers on, then we are, apart from being extremely stupid, we are not helping the problem. We are allowing it to stay the same or even become worse. I feel that this is an incredibly important role that we take. I personally think it's a role that should be more government sponsored than locally. Unfortunately, social workers don't always get the sort of press that they totally deserve, and that in itself can put people off becoming social workers. And we have to do everything we possibly can to try and increase the number of social workers. And if the scheme is proving, as we've been told, that those people who join it through this route stay with us, then we need to keep going. Thank you, Chair.
Any other members? Councillor Thew.
Could I ask how many Grow Your Own people you have this year?
So we have 4 every year. Sometimes we've had more, sometimes less, but the plan next year is 4 individuals.
Shall we move on to the social worker pay review?
So members remember a few years ago, we were losing a number of social workers, particularly in children's services, particularly experienced social workers, because our pay and grading fell particularly behind neighbouring authorities, particularly England, but also our neighbouring authorities. What we did, because there are 3, at that point in time, there were 3 social workers at 3 levels, level 1, 2 and 3. It was the level 3 more experienced social workers where some other authorities, for example, introduced golden hellos to attract experienced social workers, and we had to do something quickly. The first thing we did is that we implemented a 12-month market supplement. So that meant there was an evidence base that our level 3 social workers weren't being paid at the same level as the local market, and they were paid an additional payment to enable them to get equity of payment and reduce the exodus that we were starting to see. What we created, which many other authorities have, is a level 4 social work post. So that because previously you'd become a level 3 social worker, very experienced. If you wanted to go to the next grade up, it meant taking a management position, and there are very few management positions. So the level 4 becomes our senior social work position. So that is a new grade that was put into the structure, which meant within each team there were a certain specified number of senior level 4 social workers identified, which recognised people's experience, their ability to act as a mentor, and to be within that team supporting the people who were working through their progression. We implemented that, and then it meant that there was a shift up for the seniors who became deputy team managers and team managers. That brought a greater balance and comparison with neighbouring authorities. There was a cost to doing that. This is the last year of that cost. So what happened is that we were allocated funding to fund that, but people were paid at the bottom of the new career grade. And now we're in the final year of that. And this is the final cost pressure because it takes people to the top of their grade as they've progressed. I would suggest that committee don't have any choice with this one. The money's already been committed. We are in that process.
Councillor Mackie.
Thank you very much. I'm going to tell you a little story. Because this is not about just having names in places. Think about this. You're a young child. You're suddenly find that you're not living with your parents anymore. You have a social worker who's working with you, and that social worker creates a rapport with you. And then that social worker leaves. It's a double whammy for these young people. And we've got to try and avoid that. So as well as being important for our cost issues, that we're not paying agency people or people who have opted for that, we are retaining our social workers so that we provide not just names in places, but a better service to the people who we are giving that service to. Thank you.
Any other members on the social worker pay review? No. We'll move on to number 6, partnership working cost increases.
Thank you. So Flintshire work with a number of partners to ensure that where it makes sense, we join together to deliver services across sub-regions and regions. There are a number of partnerships that Flintshire are a signed up member of, and the cost of delivering those partnerships has increased, and the costs are associated with staffing increased as well as demand increases. So to help Scrutiny understand, we're a member of the emergency duty team. So this means that out of hours, there is a team, they're based in Wrexham, they cover Wrexham, Flintshire and Denbighshire, and they will respond to emergency, not routine, social work matters that arise after 5 o'clock at night and before 9 o'clock in the morning. We all know in people's lives, they don't have emergencies 9 to 5. We need to have the resilience to ensure that those who absolutely need it can have social work support out of hours. The costs of providing that services have gone up because the staffing costs associated with gone up. So that's £9,000. We have an integrated family support service that's hosted by Wrexham. That's a direct frontline team that provides support to families where there are parental mental health and substance misuse needs. The demand isn't such that it would require a team individually, both in Wrexham and Flintshire, but jointly there is that team, and it's hosted by us in Wrexham. The casework that they're picking up and their costs mean that Flintshire need to contribute more to deliver that service, and that's an increase of 80,000. The North Wales Adoption Service, we don't have a choice with the adoption service. We are mandated to work as a region, as all are, to provide an adoption service for North Wales. The operation of that service, for our contribution, it's done on a population pro rata base, is an increase of £36,000. The next one is Newsys, which is our equipment store. It's a very effective, very responsive service. It's about getting equipment out there in the community very quickly so that it prevents people ending up falling and being able to live independently, but also enabling people to get out of hospital quickly. And I think the other element that they focus really well on is collecting and recycling and repurposing equipment. That is a joint stores between ourselves, Wrexham and Health, and our increased contribution is 143,000. It sounds a lot, but actually that's a lot of equipment, and supporting people at home with equipment is probably the most cost-effective thing that we can do, rather than people ending up in care home placements. And the last one is Action for Children. So Action for Children run a residential home for us that has two arms. It specialises in support with children with complex needs through disability. It provides respite. There are 3 beds providing respite to families on a rolling basis. If I just jog people's memories, CIW identified that there was an under provision of respite for disabled children and their families, and it was an area of service that we needed to grow and expand. The second element in the provision of Erosfa is they have I say wing, which sounds very grand. They have an area of that provision that is able to support 2 young people in a registered setting as their home until 18, if that's what's needed. I reflected earlier in the commissioned fees, the costs of paying people, utility bills, all of those things have gone up. So Action for Children, who we run that home for us, their costs of running that home have increased, and that would be by £59,000. So the title is Partnership Working Costs, and I just wanted to give some detail about what sits behind that. There are some of those partners who've not received an uplift to budget for a number of years. We've resisted it for as long as we can. We've scrutinised it, and they're the points that we think are reasonable and unavoidable.
Thank you, Chair. I think when we're looking at cost increases on the for a system or systems that we're using, we all know that we live in inflationary times. We all know that costs are increasing all the time. The services that the Chief Officer's just mentioned, I've been to see some of them, and we are providing absolutely superb services. The equipment, for instance, when my mother-in-law came to live with us, she didn't have anything. I can't tell you how many bits of kit she needed just to live at our house. She needed 2 wheelchairs. Why 2? Because she needed one upstairs and one downstairs. Because nobody has yet devised a stair lift that will take a wheelchair from downstairs to upstairs. Now, I reckon that would save a lot of money, because as well as having two wheelchairs, she also had 2 roundabouts, because she had to get off the wheelchair, turn round to sit on the stair lift, then go upstairs, and there was another roundabout at the top of the stairs so she could get on a wheelchair because she couldn't move. And that meant she was at our house where she got all the care she wanted, and that equipment was needed on day one. And the equipment, it's an amazing place to go to. If you haven't been, I'm not going to suggest we all queue up to go, but if you get the opportunity to go, I really would go and have a look at it, because it really is an extremely well organized system. And they even have special vans that are specially covered inside, I think would be the best description, so that they can be kept absolutely germ-free, for want of a better word. They have to be cleaned out, and everything has to be sterilised. And then the equipment refurbishing is absolutely wonderful to watch. And they have a drying room so that the equipment is washed, and then it goes in the drying room, and then it's been taken to pieces, it's all put back together again. So these are things we have to have, and if they're going up, if there are price increases, we're going to have to fund those. Otherwise, we're going to lose the services. Thank you.
Councillor Lister.
The respite care action for children, does the figure that's quoted here just account for the increased cost of those 3 beds, or is there any increased capacity? And then if we are aiming to get in, more respite, is that going to be an in-year kind of overspend if you do manage to achieve it next year?
Okay, so it covers just the additional cost of providing the same service as of today. So it would be no enhanced capacity. What we are looking at, so we have a separate programme which we're calling Care Closer to Home, which is how we develop in-house residential support for children across the piece between now and 2030. As part of that programme of work, we've identified the need to increase our in-house respite offer. That has to be done in a registered children's home setting, which is why it's formed part of that work. What we're doing, though, is also working with education around that, because what we have to bring together is the educational needs of where those young people will receive their education and what education now, and where we will need residential to go hand in hand, and how we bring those things together. So in the forward plan for enhancing respite, there is a work stream around respite, working with education, but that's not included within this. There is a funding stream for Welsh Government, and we apply to that regularly each year, which is about the support that local authorities need to develop their own in-house provision and expand that provision. So we would be looking to Welsh Government to help us as we develop that over the years.
Teeneath is next.
So talking of residential care, Teeneath is our in-house residential provision in Mould. That is a very unique provision in that the focus of that is reunification. So that looks at how children and young people currently in the care system in residential care can be supported, ideally, to step down to safely and appropriately live with family and care, other extended family, or move into fostering provision. It's a joint provision that is between ourselves, Wrexham and Health. It was set up with Welsh Government funding. That Welsh Government funding was over 5 years. The challenge we have with that funding is that there is no inflationary increase with that funding. So we are allocated, next year is the last year of that funding stream. There will then be a son or daughter of that funding stream, and we're working to look at how we can move that across to whatever that funding stream will look like, but we don't yet know. It's largely dependent on whatever the administration is of the new Welsh Government. But what we know is the cost of running that provision has now exceeded the grant. So this is our known increase for the operation of this. This is a cost that, as well as Flintshire is needing to contribute 217,000, Wrexham also need to contribute 217,000. So I'd want to give assurance that those costs are not disproportionately falling on Flintshire. They are an equal partner, and we expect them to contribute equally. Again, there are a whole combination. It's the same in issues that we've reflected around the independent sector. There's no headroom for inflationary increases for staff, for utility bills, all the running of a children's home.
Councillor Coggins-Cogan.
Thank you, Chair. I mean, the question I did have was about, because obviously if there's no uplift, then I was wondering if you come to this committee, because I'm still relatively new to this committee, whether you come to this committee every year with the same report, because if there's no uplift, obviously you have to, so it's an annual deficit, but obviously this is the last year of the funding. If this is the increase, what's the total funding, just so I have an idea of how much of this increase, what portion of it. And I presume in your representations and advocacy with Welsh Government, you're saying that it's important that these are in future have some uplift element, because otherwise it's just an ongoing pressure for the councils that we are not structured to deal with. So yes, thank you, Chair.
Yeah.
So the first question I need to take away to find out the exact figures, and we'll come back to you. Apologies that I don't have that to hand, Councillor. I think though, I need to be transparent. This is the first time we've come asking for an uplift. The first couple of years we were setting this provision up, so actually we were able to deliver within the provision. I think then we've been building that provision up. So we started with a couple of people and taken the capacity. We've now got everyone in post. The occupancy that we're going to get, it's usually around a maximum occupancy of 75% is the planned model. And also, so this year and next year are the optimised running, but the optimised costs. So we haven't been back each year because we've had vacancies and we've had ways that we've been able to offset and keep us within budget. But unfortunately, the last year of the grant is the year that we've not been able to contain within the budget that we've got. If there are vacancies or, then that might have a positive impact, but there are no indicators and we're running, assuming that actually it's going to be full year cost, and that will be the pressure for us.
Thank you to the Chief Officer for the explanation. Just to make my comments crystal clear, if you had been coming here every year asking for an increase, that would have been perfectly understandable. The tenor of my question is more criticism of Welsh Government giving us a fixed amount
when they know
in this pretend universe when no costs go up. So I think if you had been coming here every year saying, actually, we need a bit more cash to top this up and make the scheme fully effective, that would have been absolutely the right thing to do. So I just wanted to give you that reassurance, Chief Officer. Thank you. Thank you, Chair.
Thank you. Shall I move on to the next one? So number 8 is Buckley Extra Care. We know the extra care model of support is a cost-effective method of meeting low, medium and high levels of support needs. Flintshire, as a local authority, have invested in extra care, and we've got provisions in Mould, Flint, Shotton and Holywell. They're very popular, they're very effective. People like extra care. The pressure for developing and expanding to deliver extra care in Buckley was proposed some years ago. It was when we opened Holywell Extra Care. Due to COVID, that was paused. I think the reality is that looking at next financial year, if I put my cards on the table, if we were to determine, yes, there is a business case and we would need to refresh the business case for having an extra care facility in Buckley, we'd need to demonstrate that it would be full, there's a local demand. We would need to work with a housing partner to be able to develop that provision. We would need to get the land, we would need to get provision, we would need to commission a construction company. My position is we would not, even if we said, yes, let's do it tomorrow, we would not get in a position where we had Buckley Extra Care operating next year. So I think that if there were any, where I would suggest Scrutiny not move away from the principle of Buckley Extra Care, but say that there's scope to defer the payment given all the work that should it go ahead, then I'd be saying this is the one that there may be scope for you as a Scrutiny committee to identify as potential for deferment, but I open that up for your discussion, views and questions.
Councillor Lister.
I'm really sorry for this question, but what is extra care?
I just think people must tired of my voice. I'm going to hand over to Karen.
Thank you. So extra care provides really an opportunity for individuals to live within their own home. So they have their own apartment, for example, within a larger building. Each have their own front door. They close the front door. It's their own property. But on site, supporting people across the whole of the scheme, there are care providers. So those care providers can provide care to one person or both if there's a couple living together. It's a real advantage to some of the traditional residential care, for example, where if one person had care needs and the other member of a couple didn't, that often sadly led and still does lead to them not being able to live together. So it bridges some of those gaps. But also within the schemes there are communal areas with restaurants. There's often lots of activities going on, activities room, etc. So it really does provide that extra level of care and support. But when people shut the door, it's their own house and they stay there. So yeah.
Do these places mainly cater for the elderly, or are there LD and that?
In the case of these schemes, they primarily would be for older people. We have other provisions that are for people living with learning disabilities, some of the supported living accommodation that we'll be talking about a little bit later on. But the extra care schemes, yes, they're older people focused.
Just on that point, I don't know if it's worth, because there are some new members on the committee, maybe members could go and visit an extra care facility at some point. Councillor Johnson.
I was just going to make that point there, because I know that Councillor Palmer might have been very, very lucky. We've been to the one at Plaza Wern in Holywell, and it really is an excellent facility to go to. And I was just going to say, if the chair, yourself or Craig or Christine could organise the members to go around, they have an incredible time. It's really, really positive, the whole thing about it. Yeah. But if you're going to go and see it, see how it works. I'm a fan.
Did you want to come in on that, Councillor Palmer?
Yeah, also, it's not just that they've still got their independence, which when I visited, that was the thing they liked. That they're living in their own house, but they've got a safety net, as it were.
So if we pop that down as an action to organise for committee members who are interested, I've got Councillor Mackie and then Councillor Claydon. Go ahead, Councillor Jones.
Just really quickly, Paul's just said, have a meeting there. We have previously had meetings in our extra care facilities. Cleese Eleanor, we had many moons ago there. So we can always arrange, a scrutiny meeting at one of them, and then, that people can take advantage of the wonderful surroundings. So I'm sure Margaret could arrange that maybe in the future. No, okay, right, okay. We can go to the gardens.
It has to be hybrid.
Sorry, we've had some wonderful meetings in extra care facilities, and one we've been around, people just want to book their place. They're so impressed. They're amazing. We've been on this journey from day one, and it has been amazing as a scrutiny committee. But unfortunately, due to the need for hybrid meetings, we're unable to hold our meetings because we don't have the facilities. So unless we can come up with a mobile system, then at the moment that's not doable, unfortunately, Councillor. It's very regrettable. But we could, obviously we have had a site visit quite recently, but I think for new members it's something that we really would benefit from. Thank you.
Thank you, Chair. Just want to tell you this. We were visiting a new extra care facility that just opened, and people were moving in, and there was a lady sat on her own in the lounge, and I just went over to talk to her and asked her how she was finding it and so on, because that's when you get the real words. And she said to me, I'm really looking forward to this, because this afternoon my husband is moving in with me. He hasn't been able to live with me. He's lived elsewhere from me. Here, he can live with me. Wow.
Councillor Claydon?
Yeah, we have discussed site visits before, and I was wondering how the programme was going because I haven't heard anything more. So, are they running at the moment?
The most recent site visit we had was to the new extra care. I think Craig is indicating. I'll let him take over. Thank you.
I wonder, Councillor Clayton, are you referring to the rota visits? I need to find out. That's a good point. Apologies. So Jane Davis isn't here today, but I'll pick that up with her. So that was where members put themselves forward to be able to visit care homes as part of our assurance around the quality of care and meeting residents to get their experiences of provision. So thank you for raising that.
They are very valuable. So, you know, I've been on one to Marleyfield and found it really interesting. So I would like to carry on with them.
So are members content with the suggestion to defer the £680,000 expenditure on the Buckley extra care facility? Is that something that we're content with as a committee? To defer the expenditure? Because as Craig's outlined, it wouldn't be possible to do it in this financial year anyway. I'm seeing nodding heads. Yeah. So there's one for you, Cabinet. Next one is discharge to assess.
I'll be really quick with this one. This is a post that we need to support. It's a pressure. Karen Chambers recently built that into a bid to Welsh Government, and Welsh Government have funded it. So I would suggest we could remove that as a pressure.
Councillor Cogan.
So that was my fault. So I was reading this and I'm useless at multitasking and I apologise now. Did you say you put in a bid or the bid's been successful? The bid's been successful. Oh, okay, then fine, yeah. Get rid of it.
And that's something we'll continue and always do with our pressures. If there are opportunities to get funding from another source, we will do that to remove the burden on the local authority. But the last one, if that's okay, Chair, is Social Services IT system. Sorry, Councillor Mackie, if I wasted. Along with, I think it's 16 local authorities in Wales, we are moving to a new IT system. The Paris system is very old, it's over 20 years old. It doesn't give us both the operational workflow that supports practitioners, nor does it give us the performance and operational information and data and intelligence to enable managers to have good performance oversight. We have to do lots of workarounds on that system. Again, I would draw your attention, CIW identified it as an area that for improvement that we needed to look at replacing. We're already signed the contract. We are having the workshops with the provider to design that new system. We have funding from Welsh Government in terms of that new system. What it doesn't fund is the legacy system. We can't simply turn Paris off and turn Mosaic on. There has to be some dual running. There has to be data transfer. So there will be costs with having for a period of time, two systems running. So this pressure reflects the true implementation cost of the new IT system. It's unavoidable, and I don't think it's one that we can not agree to. Sorry.
Councillor Mackie first.
Thank you, Chair. I was here when Paris was put in. That's right, isn't it, Christy? Yes. Right. I remember. And we're in the same position today, I think, than we were in all those years ago. And it must be it must be 12 years ago or even longer than that, I think. Probably 15. It might be as many as 15. Yes, I've been here that long, believe it or not. But we were hearing exactly the same things we're hearing today about the Paris system, about the system that was being replaced then. We all have to appreciate, don't we, that computer systems have a life. And once you get to the end of the life, it's more costly, it's more of a pain, it's more of a nuisance to keep the thing going than it is to take that step, which nobody wants to take, do they? To switch to a new one, and then eventually you're back on that same track again, because guess what? In 15 years' time, you probably want to replace this one as well. So I think we have to be quite honest, it's quite a small amount, and we've got to be aware with our IT systems that this does crop up, and whenever you've got an IT system, it's not going to be there forever. You are going to have to upgrade it at some point. So I think we can accept this, and we've dug down and we've proved that it's necessary.
Councillor Lister, did you indicate?
Question. I was just wondering who is responsible for that data transfer? Is it done in-house here? Have you it's quite a big responsibility, isn't it, to make sure that that data goes over?
So there's a project. Well, if we think of it as a program, there's a program called Connected Care, and there is a report coming. I think is it February, January? It's on the Forward Work programme to take members through this. So Connected Care is a Welsh Government programme to ultimately lead to a shared care record between health and social care. That doesn't mean the same IT system. Many years ago, there was a vision that there'd be one IT system. Flintshire never believed that that would be the end goal, but this is about, there's lots of language about data lakes, and you put data into data lakes and you can connect it and people see the relevant data. The first stage of that programme is implementing a new IT system. And as I said, I think there's 16 that have gone with one system and some others that have gone with another. WLGA are programme managing that transition for the new system for the 22 local authorities. So we have a local project board for Flintshire that sees our local implementation. Then we have a North Wales implementation programme board. I chair that on behalf of the 6 directors, and that's looking at where it makes sense that we do things together. So training materials, we are not writing 6 different training manuals. We're not holding 6. We're doing that collectively. What we want is the North Wales workforce all trained in the same way for the system, and if people move around, or if you're working in EDT and covering 3 local authorities, you're using one system and you know how to navigate that. Things like data migration, there is a national, regional and local element to it. So nationally, there's a strategy and a safe way to transmit that data. Regionally, we're working around how we do some alpha testing on that. And locally, we need to test our own data to make sure that it's worked. So it's a multi-layered answer, but we are getting support. Ultimately, a lot of that does fall to our in-house team. So that has impacted on the digital transformation and the digital strategy programme board work. There was a piece of work, we need to replace Masterpiece, haven't we? But we've had to do the Paris system to fit in with the national programme ahead of Masterpiece. That's because the local work that needs to happen by our IT needs to happen at a point in time, which means they can't do Masterpiece. So there is an impact and there is a resource, but it's part of a wider system.
Councillor Coggins-Cogan.
Thank you, Chair. Along with Councillor Mack, I support the introduction of the new system. So is it likely that Paris will just be operating for just the next year, or is it going on sort of the year after that? And so does this mean the 135,000, is that just for next year, or so do you anticipate extra costs after that? Okay, thank you.
So I anticipate extra costs after that. So we are at the phase where we're doing the design of that system because it needs to be configured locally and regionally. In North Wales, there are two systems that are currently used. WCCIS is used by 4 authorities. Paris is used by 2. The WCCIS system, I think after March, will be an unsupported system. So it's often described as those 4 authorities are on a burning platform because it will be unsupported. So there's a scheduling across Wales because not everyone goes live at the same point. There's a scheduling. Those on that burning platform go first. That means what we say is we're on a decaying platform because it's working, but actually it becomes less and less as time goes by operationally. So assuming everyone else in Wales goes on their allocated date, it would be November next year when we'd be looking for go live in Flintshire. My experience is that however well planned and well intended, the chance of 15 other local authorities or 14 going on time without hiccup, even in the, we need to be realistic. So I always refer to November as a target date that we're currently working to, and that will be continuously reviewed. So I think it's only going to be the latter part of financial year before the system even goes in. So it's definitely going to impact into the financial year afterwards. We need it to be very stable before we switch Paris off. So I do anticipate there will be costs the year after.
Thank you for the comprehensive answer. Do you think it'll be approximately the same amount again, or proportionately different? I don't want you to be Bruce Forsyth playing higher or lower, but just an idea. And have you considered lying to Welsh Government, saying we've got the old system that's about to crash completely, and then they'll bump us up a bit sooner?
So a lot of the costs are known costs, like licensing costs for 2 systems. So I would anticipate it's going to be broadly the same, but we haven't done that detailed work. But as a barometer, I think it will be there or thereabouts. And of course, the answer is no to the second one.
Going last is usually better with IT systems because the bugs have been ironed out by somebody else.
Very, very good point, Councillor Mackey. I think we've all experienced that before. Should we move on to, there's the out-of-county placements cost pressure as well.
So this is the last one, and this is a significant one. This is one that is a joint education and social services and cost pressure. We are still seeing significant demand for out-of-county placements. We have increased challenges with some young people that display levels of dysregulated behaviour, which sometimes put their school placement at jeopardy. So we're seeing some young people that need intensive therapeutic home environments in residential care, which is the best place for them to stabilise and provide the support. There's often years of trauma for those young people, and we need to support them, and we need to ensure that they're able to engage in a good quality level of education and have a comprehensive plan around them. We are seeing across the piece more and more demand for that. Yes, we are investing and developing our in-house provision. A few years back, apart from Action for Children, which ran the provision for disabled children, we had no in-house residential care homes. We've now got 4, all of which are operating. We are in phase 2 of that, which is about acquiring properties to develop our own in-house provision. They take time. You have to get the property, you have to get it to standard, you have to get registration, you have to get the workforce. It means additional demand would not be able to be met through in-house additional capacity next year. So Unfortunately, out-of-county placements are very, very expensive. Years ago, it would be about £3,500. We're now talking £6,000, £7,000, £8,000 a week for just the social care element of that. We're seeing packages beyond £10,000 is not unusual. We need to be realistic about the potential for additional cost pressures for out-of-county. Sarah will be presenting later on a report, because what we're not doing is sleepwalking into this. There's a massive project that we're doing called the Reconnect project, which looks at not only how we develop our own provision, but how we support children to step down from that provision. But I won't steal her thunder. We are continuously and be doing some further work around forecasting, but our view is it's prudent that we need to reflect the pressures that are already present, and we anticipate will continue for education and social services on out-of-county budget.
Councillor Coggins-Cogan.
Thank you, Chair. I think whatever mitigations or anything like that you put in place, I mean, obviously it's demand led, and I think it's bigger than your portfolio. So taking advantage of the cabinet members here, you know, the two deputy leads and the cabinet member responsible, I'm not asking for specifics anyway, but does cabinet have an active contingency plan should the demand for placements go up? Because I think for the sake of the chief officer's sort of confidence in doing his job every day, we need to have something rather than, well, we'll use reserves. There has to be some kind of plan. I'm not asking for the details, but has it been actively considered by cabinet is my question. Thank you, Chair.
Oh, you'll be aware that constantly there's a pressure, always constant pressures on. So I'm here. Always constant pressures on social services. This year, we have to bring in social services action plan, which I'm sure this committee's been through there. It isn't sometimes, you know, members won't be aware of the difficult financial situation that we are in. We're at the moment looking at the stages that we're at. It's not really going to answer the question. The issues around the social services budget, I think I can very confidently say, have been talked about in cabinet and wherever in some detail. So we are aware of the pressures that are on that. Moving into next year, we are aware of the pressures, and we know those aren't going to go away. It may be that one of the things this committee may wish to have a look at, because I don't think you perhaps have looked at those details, is actually look at the way that Crossca's gone and done, and looking at their action plan. I think we've discussed that Crossca, you remember, and Craig was there talking about the pressures on the social services budget and their action plan. Whether that might be one way to, I wouldn't say reassure you, but perhaps with the committee give them an understanding about the challenges that budget provides, and the issues that the unique, I would say almost unique, because the demand here is so challenging, imposed on the budget overall. So it is something we've got on our agenda. It's some of the things we have looked at, but I think at the moment we're looking at stage 2, which is, do you think the budget pressures are reasonable? And when we come to stage 3, I think that's where that kind of discussion has to move. I'd be grateful for more questions like that when we come to that. Oh, well, no, I don't actually. I don't. I would say to members, I was going to say this here, that I'm more than, you know, I have a very dodgy blood vein in my nose at the moment. That if members wish to go and discuss the budget further, I'm more than open. I'm more than happy if the chair wishes to come and talk to me about what's in the social services budget, this document here, and the pressures. I'm always open to that. And the final thing is, and I'm going to copy what Councillor Mackie went and did this morning with us, with education. Sorry, and it's very good. He said, You're going to quote it. This review by the Overview and Scrutiny Committee for the period 11th November to the 4th of December is aimed at scrutinising portfolio costs and pressures to provide assurance that they are an essential requirement for the 26-27 budget, and to ensure there is no scope to remove or defer them to assist with the dealing with the budget challenge. And you've got the committee this morning to say, yep, and agree with that. I'm just wondering whether you'd like to do that this afternoon. Yeah, because I think as a when he's in my position, knowing that that's the view of the committee is a very good one to, it's very helpful when we go forward. Oh, thank you. Thank you.
Thank you, Chair. I think we're doing so much now, now and have been for a long while now, in our departments to bring down that pressure. I mean, the children's homes, you know, the reconnect that's going to be coming in a wee while from Sarah, fostering, you know, we're really working so hard on our children who unfortunately at the moment have to go out of county to these high cost placements. But I think as a department, as a portfolio, we've been really innovative and we have worked really hard, and that is continuing. So hopefully those, you know, pressures are going to be, you know, showing some benefits in the near future. It doesn't happen overnight, does it? Unfortunately, things don't happen because you're dealing with complex issues. And it's not going to happen overnight. We can't build a care home, another one overnight. But it's in the planning stage. But we've got 4. So, which is 4 more than we had, say, 10 years ago. So, you know, the costs, you know, are coming down. But they're also, you know, we've got to look at the non-for-profit that's coming in. And there's a lot of things coming down the line that we're having to address as well, which will affect, obviously, you know, that budget. But the reconnect, I'm hoping that when Sarah presents it, that'll give you some understanding of what we are actually doing, and that we can make a big difference with that programme. And also, we continue to put pressure on Welsh Government to address this out of county pressure, as we do with all our partners in the region, because everybody's under the same, having the same issues, because there's not enough placements for these young people. So you fight, the market is really difficult, and you fight for the placement. And because it's for profit at the moment, they can charge whatever they like. So, you know, we're all battling for one space, and it could be 10 children battling for one space. So it goes to the highest bidder. And that's the problem, isn't it? You know, that's the pressures that we face on a daily basis. We could have a sibling group coming in this Friday, and it could cost us £20,000 just for that one placement for that week. So, you know, there's always constant pressure. But I think as a portfolio, I think we're really working hard on it, and we appreciate everybody's support, you know, for the things that we are doing and that the officers are doing. So.
Sorry, did you want to come back, Councillor Coughlin?
Yes, thank you, Chair. I'm grateful to the Cabinet members and the Deputy Leader for the answers there. One thing that struck me then, again, using my ignorance as a weapon, because or as a shield rather, because I'm new to this committee, I had perhaps naively assumed that the sort of escalation in costs that you were talking about a couple of years ago, say £3,500 today, could be between 5 and 7, and perhaps even £10,000 a week for the packages. I thought that was commensurate with the needs, but from what the Cabinet member saying, that so you could have someone with very basic needs, but because there's in that particular week or whenever that goes to the market, there's a real shortage, you could be paying prices through the roof. So yeah, it's an example of where, you know, market forces are somewhat undesirable in this care sector. So I thank you for the Cabinet member for that explanation. It's very interesting.
Yeah, can I just say, sometimes it's the real complex needs that they have to fight to find that placement, because there isn't enough of those placements out there. You could have one in Scotland, say, and that's the only place that that child could be looked after because of the needs that that child needs at that specific time. So, you know, you have to look at each individual case. And education comes into it as well as on certain ones. So, you know, you have to, it's a pool budget, as it were. We work with education or out of counties as well. Because you've got to have, you know, that child has got to be looked after as a whole. So that, you know, their well-being is all our responsibility, whether it be educational, social care. Okay.
Craig, and then I'll bring in Councillor Jones.
So I'd just say two things. It's been a couple of years, but a couple of years ago we did some analysis, analysis, and for every bed that we were looking to find for a young person, a provider was receiving 62 referrals for that bed. So that gives you some notion of them being able to consider who they took and what charge they made for that bed. To be quite blunt, that is part of the reason that's driven Welsh Government's agenda to eliminate profit from the care of looked after children. There was a report by the Markets Commission around the practice across the UK, and that was quite damning around the level of profit that was being made in some areas. I want to say it's not, as everything, it's not a universal truth. We have some really good, particular local providers that put their profit back into delivering good outcomes, pay their staff well. So I wouldn't want to say it was a universal, but it is a big problem, and that's why we've stepped into that space. I think in terms of demand pressures and Cabinet, I think one of the challenges that Cabinet could have said to me, and may still say, in terms of that assurance you were seeking on my behalf, thank you, is that we've got a report come in which identifies potential significant savings around out-of-county budget. And when we put a pressure forward for next year, Cabinet could say, well, you've got a paper there that says you're going to potentially deliver £3 million saving on out-of-county. Use that for that pressure. But I think there's a recognition that that's going to take some time to deliver, and where we are with the market, so that in Cabinet, recognising it's a combination that we're putting that pressure of 2.5 million forward across education and social services, but also looking at a plan to reduce expenditure. If that works out, there should be some cushioning should there be that increase in demand over and above what we've already forecasted.
Yeah, thanks, Chair. Appreciate that. As out of county placements, I was going to mention, because in between month 6 and month 7, there's actually a difference of just shy of £750,000. So if you think about that, that's how things can change in terms of demand. So, you know, it depends on, it could be 3-4 children just, or a family coming into the county on that one period, and that's how much it could increase just because of that. And Dave will remember, and I know there's a few other people who will remember. I mean, going back when I first came to this council, and I was on People and Performance Committee, Dave, you might remember. We used to talk in numbers of, I want to say 5 million out of county placements. It was probably around that figure. And we used to think it was extortionate. We used to think, how can that be? You know, well, the budget now is over 22 million. And that gives you some idea of how it's grown just over that period. It's very difficult to imagine demand. And I think if you look at the kind of overspend in social services at the moment, which is just shy of 7 million, we didn't plan on that, did we? We tried to anticipate it. The officers try to look at trends and anticipate what's going to happen, but a lot of it is just not in our control. It's very difficult. And it's that demand and complexity, not just demand, it's the complexity of that demand. When you get a person with multiple issues, that becomes expensive as well, just like demand does. So it's not an easy thing. It's not an easy circle to square.
Councillor Hugh.
Joel. I was just hoping that any money saved, if anything happens like that next year, can that be ring fenced to ensure that that goes back into social services? We want it ring fenced.
Diplomatic silence from the chief officer.
So the first thing is it's a joint education and social services budget. So I think if I was education, I'd have a view on that in fairness to those colleagues. I think the reality is social services has a significant overspend this financial year. Even with everything that we're doing, I cannot envisage that we will have removed all of that overspend into the next financial year. In some respect, it's wooden dollars taken from one bit to another. Yeah. I know, yeah, helping.
Yeah, just on that, I mean, it could be an additional recommendation if members wanted to move that. But Councillor Lister?
Mine's a very quick question. 2.5 million split between you and education, so 1.25 each. Each paid 2. It's 5 million in total. No, tell me in a minute. And the other question is, out of county, I know we've talked a lot about children. Does it also apply to adults? And like, what figure does this represent? Like, how many people have we got out of county?
So this budget is purely children. We do have adults out of county. When we talk about, it's really confusing. Out of county means that the provision is outside of the provision of the county council. So we have children placed in Flintshire who are on the out of county figures because they're outside of our provision. So for example, Bryn Tyrion springs to mind in Caergurley is a local provision, but the children who go there for both education and social services are classified and coded to the out of county budget. So don't automatically equate physical location. We're talking the funding stream around being out of county. So in Flintshire currently, the latest figure that I've got, because it does change, is that there are 42 children from social services perspective funded through the out of county budget. But that fluctuates as children come in and out of that provision. The pressure that we've put in is the total pressure between social services and education, but it's not a 50-50 split. And we manage it as a joint budget. So often it would usually, if there was a package, fall to about 70% social services, 30% education funding that package, because the care and support needed from a social services is greater than the education hours. So that's how that works, and the holidays as well. So please treat that, we treat it as a single budget. That's a pressure for the single budget, but we don't divvy it up. What we recognise is we've got a joint panel, we jointly approve people who go to be funded through through out of county, and that's the pressure across the total bills that we get in.
Councillor Thew?
I'd like to make a proposal that 70-30 split is ring fenced as just outlined by Chief Officer. Thank you.
Recommendation 3.
Do I have a seconder? Councillor Coggins-Cogan, so we'll add that as a third recommendation. Second recommendation even.
That's the third now, I think, because we've got the one about the deferral of the budget.
Yes, third recommendation. Before we move on to the recommendations, I don't know if, Craig, you wanted to go through the action plan at all?
Yeah, sorry. I promise the next 3 items my colleagues are delivering, so this will be the last bit of my voice. So, Councillor Johnson referred to a meeting that we had at Crosk, and at that Crosk meeting, we presented the in-year action plan for social services overspend in year. Each portfolio is required who are overspent to produce an action plan that was presented at Crosk. And as Councillor Johnson reflected, Cross felt it was really important that you as Scrutiny was cited on the significant overspend that we have in social services and the action that we are taking to respond to that. And that is included as Appendix 1 in this report. I think it's really important because it reflects what's driving some of the pressures that we have in terms of the demand. So the latest outturn, which has not yet gone through the political process, as it
becomes public
tomorrow, is so that we have from month 6, there has been an adverse overspend in the budget. So that will come out tomorrow, but it is significant. I think for me in this action plan, it chunks down a lot of work that's happening by officers and managers across the portfolio. So the first bit, and this started back in April because we knew that there were financial challenges for us. The first bit of work that we did, which I expect you to do, is what we call the review, learn and deploy. So we did a piece of work to look at not only what other social services departments are doing, because we're not unique in Wales, but we also wanted to understand what was happening across the UK and where there were lessons and approaches that we could deploy and implement locally. That piece of work concluded that there were 4 main actions that local authorities across the UK were taking. The first was looking at how they manage demand and promote early intervention. The second is how they review and reduce costs of care packages. The third was how they use technology and alternative service models to support people. And the fourth was how they could increase efficiency in workflow and processes. So that sounds kind of just 4 work streams, but there's lots sitting under that. Our conclusion, having looked at all of that, was that the majority of the actions that were being taken have either been implemented already in Flintshire, are being implemented, and there were some that couldn't be implemented due to specific Welsh legislation. But there were some things. The second is that we moved into a phase that we call demand and performance insights. So that's where we did a desktop review of budgets and potential areas of savings. We had a senior management team budget workshop, so where myself, my senior managers and all my service managers met to really drill down about what we could do. I then met with every single service manager across the portfolio with my senior managers to do a deep dive into their budget, the in-year pressures and potential savings and cost avoidance that service managers could do, and they were given the autonomy to go away and do it. So some of the things we identified were we need to do that consistently across the portfolio, and some things where you as an individual service manager, go ahead and do that. It's a great idea, please deploy it. The other area of work that we have been taken is doing a deep dive to understand demand and costs. So actually, our costs are going up. We know that's because of demand, but what's driving that demand? And we did some work focused on increased work costs. So what we were seeing were increased costs in direct care overtime and use of agency staff. So that's where we have in our direct registered provisions minimum standards of staffing that have to be deployed and meeting demand. So understanding that, understanding the hospital demand that continues month on month to increase, and associated to that increases in reablement packages and demand for reablement. We've done a lot of work around that, and we're at the final stages of pulling that together into a report. I think I referred to it previously, though. So one of the challenges we asked ourselves was, we're providing a lot more reablement. That's costing us a lot more money and contributing to an overspend. Should we really rethink and recalibrate our reablement offer? We're producing a report, but be clear that report will say there is identified cost benefit analysis which demonstrates putting reablement in a timely, focused way does reduce lead to a better outcome for the individual and reduce long-term care. But we need to pull that together as a recommendation. The other piece of work around demand that we've done is partnered up with public health to understand the demographic need. And that's had some really interesting data that we've been able to pull together. I think for me, one of the most striking things is not the average life expectancy for people in Flintshire, but actually the average healthy life expectancy. And unfortunately, Flintshire has the lowest healthy life expectancy in North Wales. So if you are a female resident in Flintshire, your average healthy life expectancy, unfortunately, is 59. So that means on average, by the age of 59, you will have a disability or a range of illnesses that impact on your ability to lead a healthy lifestyle. What that says to me is, and your average life expectancy as a woman is 82. So that's 33 years of your life in poor health on average. So we have pockets of the community that are much lower and pockets that are much higher. And I think that's one of the challenges in the demographics of Flintshire, is that we're not like a city that has a concentrated area of deprivation that we can go into and do. It's dispersed across the authority, which means our effort and our services and our support is dispersed across the county. For a man, it's slightly better, but nothing to be proud of. 60 years of healthy living. And I think off the top of my head, it's 79 for your average lifespan. What that means for social services is inevitably earlier reliance on health services and early reliance on social care. What we're now looking at, because when we've done our modelling around forecasting, we very much focus on over 65s, but particularly focus on age over 85s. But actually what we need to do is roll back and understand that in Flintshire, unfortunately, that trajectory happens much earlier in people's lifestyles, healthy life living. We're doing that around now, the work we're doing about forecasting demand and understanding demand better, but then understanding what are our interventions and what do we need to think about doing differently, and how does that recalibrate our offer. Did people want to come in? Because I know I'm rattling through this. There are lines on an action plan, but I want to kind of demonstrate there's a lot happening below it.
Oh, it was like 25% of life was basically, 75% of your life would be healthy and the rest of it would be unhealthy. That was the kind of thing. And it was really linked to deprivation. I think it was linked to the deprivation along the Deeside Strip. That was something else. And Flintshire was the worst in North Wales. You know, but this is where the complexity comes in, because if you're earlier in life already having problems, then you can imagine that there's going to be more complex need as your life continues. And that's where the demand through life and complexity really ramps up. And I don't know, it was the same everywhere. I think it was the same across Wales. It was just that this Flintshire happened to be, I think because of the Deeside Strip, happened to be one of the areas of deprivation that was driving that as well. So, and I know Craig probably wants to mention this, but I have a view on if governments continue to invest in hospitals, you're only dealing with the demand that's already occurred. It would be much better to prevent, and that would mean more money into social services. Because I don't know, somebody gave me this analogy of a river. I can't remember who it was now. The river is there; it's illness or ill health. People falling in that river we're responsible for that, but people getting pulled out is hospitals. So if you want to stop that demand coming into hospitals, you need to invest in social services to stop that falling into the river as illness or being ill. And that was a really good analogy, I think, for me anyway. And I think that's where it needs to come back to, isn't it?
So if we think through budget allocations to local authorities are often take into account of demographics, particularly looking at older people, but actually the demographic need is different in Flintshire. So we're building that business case to demonstrate that, but also whenever there are grant opportunities to be well placed to be bidding for those grants. I think one of the things that struck me as well was that the demographics are, as Councillor Jones reflects, absolutely aligned to deprivation. However, there is an element that we can't shy away from, is that health conditions and social care needs aligned to the most affluent areas are aligned to alcohol misuse. So sometimes there's a notion that actually it's one area of the community that need our support and need early intervention and preventative services. We also have very clear data that there are specific needs in affluent areas that we need to think about around what's driving demand in those areas as well. So just to give that balance, because it's a balanced picture and nuanced. The next area in terms of the action plan we're working on is around workforce efficiencies. Sarah, am I able to invite you in just around some of the work you're doing around agency staff within children's services, because that is a big part of the overspend, and we just wanted to cite you around the work Sarah's been leading.
Yeah, no problem. We obviously have a large number of agency workers in Flintshire and some of the core social work teams, the statutory social work teams. What we're doing at the moment is we're trying really hard to exit agency workers, but in a safe way, because we know that the recruitment to permanent workers is very difficult. We've had that conversation already. So in terms of what we're actually doing is we're being very creative in terms of our Grow Your Own model, which Craig has already talked about. We've recently recruited to 5 children's services assistant workers, which also feeds into our Grow Your Own model. And the idea is there that we upskill those workers to be able to either go on to be social workers, or they are trained in delivering really robust parenting programs to really do all of that preventative work. So we're focusing on increasing our children's services assistance roles where we can safely replace with an agent, with a social work post with the CSA to reduce costs. We're doing that, but we're doing that in a very safe way. And this has to be where there's scope there to be able to, there's going to be no impact in terms of a statutory delivery of services, and it's not seen as a risk. So we're working on that currently. We're also looking at temporary to permanent recruitment. So we've had 2 agency workers that have been interviewed and are coming through onto permanent roles. They want to stay with Flintshire. We're hoping that there will be more of those moving forward. They're going through all the onboarding now as part of that. We're also working, we've obviously got our own recruitment adverts which are going out, and Workforce Development have developed a really good induction ebook, which we're doing alongside this, which is really important because it's not just about recruiting, it's about retaining. And what we want to make sure is that when workers join us, that they have a really good induction, and that they actually in that first kind of 12 weeks that they aren't kind of put off by capacity, and also that they feel they've been nurtured and looked after. So there's lots going on in terms of temp to permanent, our own adverts going out, and also being creative with what we've got in-house to see how we can actually develop and exit safely.
Thank you. The next 3 reports that will be presented will take us through some of the approaches that we're taking to strategically deliver better outcomes for our residents whilst reducing our costs or enabling us to meet demand more effectively. So I won't go into those because we'll hear that. I am just getting conscious of time, so I think the other piece of work that we're doing particularly is what we're calling the top 10. And that isn't quite right, but what we're doing in each service area is looking at the most costly packages. And a group of people are coming together to see if there is a way that we can appropriately reduce the cost of those packages by getting better value from the commissioned, the provider that we commission. So they might be charging us for 2-to-1 support, and we might actually say, actually, we reviewed that person and they don't need 2-to-1. Therefore, we can bring that cost package appropriately down, but also where we feel other agencies should be contributing more, and how we work with them to bring some of that money in. So we're having focused activity on individual cases. So there's big service work happening as well as individual case work happening about how we can try and bring the budget into line. If it's okay with members, I'm going to pass over to Dave to just draw together the next steps with the MTFS. Is that okay?
Thanks, Craig. It was just really picking up on the remaining steps of the timeline. Clearly, we've had various overview and scrutiny committees between November and December. We've had receipt of the provisional settlement from Welsh Government last week. So the report on the MTFS for the December cycle, that will be an update on the current budget planning position, taking account of the provisional settlement. So that will become a public document as of tomorrow. And then going into January, we've then got the receipt of the final Welsh Government local government settlement on the 20th of January. And then through January and February, it'll be the consideration of the final budget proposals going to Cabinet and overview and scrutiny committees. And then 17th of February, the final budget and council tax setting, both at Cabinet and full council. Thanks, Chair.
Thank you, Dave. Unless there's any outstanding questions on the action plan, Councillor Thew.
Just one thing, really. If would it be possible to view the recruitment book that you've mentioned? If you could send that out to members of the committee, would that be possible? And we'd have more of an idea of what was involved.
It's an induction booklet.
Yes. Okay. Thank you very much.
Chair, I'm leaving the meeting now.
Thank you, Councillor Healy.
Okay, bye.
Bye. So we've got the one recommendation which is in the papers, which is to review and challenge on the social services portfolios, cost pressures and actions to impact on the associated overspend in 2025-26. And then we've got the two additional recommendations which have been put forward, which I think Margaret's made a note of.
Chair, so the second one is that the committee proposed the deferral of the Buckley Extra Care Facility for 2026-27, given the work that needs to be undertaken in advance of the project moving forward. And then thirdly, if the out-of-county placement budget overspend isn't as much as 2.5 million, the committee proposed that the social services element be ring-fenced for social services use. Craig.
Sorry, I'm mindful of some of the debate that happened yesterday in terms of just the wording of that around Buckley. It might give the public the impression that Buckley would definitely happen, and that it's deferred given the work that needs to take place. I think it's around deferring with a review around the business case and whether it should take place, because I just don't want to give an impression to the public that what we're saying is not next year, but the year after, there will be Buckley Extra Care. I think what we're saying is we need to do a piece of work to ensure the business case stacks up, that we find a partner if it does, and then we work out with that partner when's the best time to do that.
Okay, I've got Councillor Lister.
Be a recommendation, but when we discussed 9, it was going to be removed from the budget line. Does that need adding? But the cost pressure, number 9, discharge to access, it's already been funded, hasn't it, through a Welsh Government grant? So I don't know if it needs to be on the recommendations that we support it being removed.
Yeah, I think we can probably add that to the second recommendation to say that the committee supports the deferral pending review and business case of the first one, and then also supports the removal of number 9. With that, I think that probably covers it, doesn't it, in one recommendation? Is that clear to everyone? Councillor Coggins-Cogan?
Yeah, in relation to what the Chief Officer said, you know, if you say that the Buckley thing has been referred back to the department for further consideration, then it's, you know, there's no expectation then, is there?
And Councillor Thew, were you content with the wording for your recommendation yet? Okay, so we've got those 3 recommendations. Do committee want to take them all in one, or no? Yep. Okay, we'll take them all in one. So all in favour of the 3 recommendations? I think that's any against or any abstentions? Nope. So that's carried. Councillor Johnson.
Could I really thank this committee for their definitely very thorough and detailed examination. The second one I've been to today, and to be honest, of all the ones I've heard, this has been the best. No question on that. It really has been thorough and detailed and very engaged. Yes, thank you.
Thank you for that, Councillor Johnson. And as Councillor Mackey's said, we have been going for 2 hours now, so I'm minded to call a 10-minute break so that members can refresh themselves and get a drink, and then we'll come back and discuss the remaining 3 items. So if members come back here for just after 4:15, we'll restart the meeting. So we are on to agenda item 6, which is Right Care, Right Place, Promoting Independence in Supported Living. And I think we're going to start with a video, if the technology works.
Fincher Progression Service is a multidisciplinary team, and we work very closely with the enablement model of support to enhance each individuals that we're kind of fortunate to be able to work with and support.
So I see you normally once a week at Parkfields. Well, at the minute I'm supporting her to the sessions, so just giving you that little bit of confidence, isn't it, and making sure that you feel comfortable and happy there.
I used to work with my mum as a work experience.
You did, didn't you?
And I look after children, and I was hoping I can teach more babies.
Someone I supported recently, when I first met him, he was in a residential setting. He had 3 support staff at any one given time. I think he just sort of lost his way a bit in being over-supported, and then over time he grew in confidence. And he lives independently now. He has no support whatsoever, but it was just making sure his voice was heard and finding him the right place that suited his needs.
They helped me to get my house they did in mode. Claire Jones was my social worker when I used to live in supported living. Then she asked me what I want to do in time to get my own flat. And then she got me my own place.
I think initially the families are always wary, you're going to take support away and what's my child going to be like without support, but I think when they see that success, there was one story a dad told me that their son had picked his birthday card for the first time ever. It would always been one that mum bought, but he actually walked into the town centre alone and bought a birthday card for his dad, and I think that just showed him just how well, with a bit of support, his son can progress to independence.
Right, so Claire, who we've just seen on the video, has had to leave. Unfortunately, she's got a prior commitment, so I'm going to hand over to Karen, who's going to deputise.
Thank you, Chair. The video that you've just seen was a submission as part of an award to the social care accolades that the team within social services has recently won. So I think it really starts to bring to life, I suppose, the report that we've brought to you today. So the Right Care, Right Place Promoting Independence and Supported Living programme of work really refers to our ambition that we should do everything that we can within social services to ensure that adults living with a learning disability are able to live in a way that their strengths, their aspirations, and whatever capacity they have to grow towards further independence is really, really supported by us in social services. So the report refers to some work that we've been doing across our supported living accommodation. At the time of writing this report, Flintshire County Council supported 175 adults with a learning disability to live within a supported living environment. Historically, the care and support that's been provided to individuals has always been around as though every individual was assessed in their own right and received support in their own right. We haven't moved from a position where everybody is assessed in their own right, because that has there's lots that's done on the basis of that assessment. But the support that we're doing now and that we are working to embed within social services really looks at that individual in the context of the whole household. So if you have 2 or 3 people living with a learning disability within a household, this model of work that my colleague Claire, who's left, has been leading with colleagues across social services, has started to look much more about the individual in the context of that household and how one person's strength can be of benefit to everybody else in that household. And that's how the household works in that more natural, supportive environment. What the paper that we've had provided today really describes the work that's been taken place, whereby we've been working with providers, initially within the independent sector and more recently within the in-house provision, to look at what that care offer looks like. We take the individual's needs, we look at the provision, and we actually use the progression model that's been referred to in the video that you've just seen to really think about everybody's potential. So not focusing on the needs and what individuals might not be able to do today, but actually really focusing on with very particular types of support, and by taking a positive approach to risk and the use of effective assistive technologies, for example, how can we work with individuals and with households to ensure that the support that we give is absolutely right-sized. We're not looking to give less than anybody needs, but actually we also don't want to provide any more. We've in the report, some of the examples that have been described is where adults have described that they always have people around them. And I think, you know, even if we just take that really human aspect of wanting time to yourself, that might be the outcome that we may be able to support an individual to achieve through this approach. So the work that we've been doing is very much based on a positive approach to risk, but that doesn't mean that we take this work any less, you know, with any approach that we don't take ultimate care to make sure that everybody is safe. So very often in practical terms, what we're really doing is to take sometimes small and incremental steps to further independence. The report talks about how we've worked with the providers of the care and support to really understand the individuals within each supported living environment. And we've looked at where we can use assistive technology sometimes to act as an additional level of confidence, if you like, to everybody involved. We very much recognise that in order to achieve the change, we've got to work, obviously, with our workforce in a different way, and we've got to work with families and individuals in a different way. We know that there's been if there's been a historical way of providing care, that we need to work with families in a different way to bring them along with the journey with us as well. So most of the work in terms of the implementation so far has taken place within the independent sector. We've also been through the in-house care and support plans and the assessments, and colleagues have got to a place where they understand what care could look like differently within our in-house homes, accommodation, sorry, and we're now working with the support of managers within the teams to look at what that now means for our in-house teams. So we're having to think about what new rotas will look like as a very practical example of what I mean by that. The approach has been very much multidisciplinary. It's included occupational health therapists, as you would expect, learning disability teams, both within health and social care, our telecare colleagues, and also expertise within our provider services who are really focused on rotas and how you can do things differently. And of course, very much the individuals and the providers of service themselves. So there's a couple of examples provided both within the report, and Claire referred to a young gentleman in her video as well. But the changes can be about doing exactly the sorts of things that other people might take for granted, going out and buying a card for a family member, for example. And these are the sorts of changes that we're really wanting to support people. So whilst the progression model is very much part of our social services approach to support sustainable models of service delivery, at the heart of this, it's about doing the right thing with and for people, to actually support every individual to live the most independent life that they can, to be able to live the life that they want to live, is the value that we all bring as social services to work every day. And so at a time where we can often be faced with very difficult challenges around some of the resource constraints that we've talked about today and previously, this particular approach to the way of working and what we're focusing on here, I think, is one of those opportunities where it really does feel absolutely like the right thing to do in every aspect. Best thing for individuals, and it's also going to support us from our sustainability agenda. We know that the number of people requiring support who live with learning disabilities are increasing, and we'll be able to support more people in a much more appropriate way going forward through approaches such as this. So I won't have given it as much justice as Claire, because Claire lives and breathes it, but I hope that I've been able to describe adequately the work that we've been doing. I'm obviously happy to answer any questions. Thank you.
Thank you very much, Karen. I'll open up to members. Councillor Few.
I won't identify the person, but I actually know one of the people on that video. And I know how much that this person's parents have, what they've done to put her on the right track for independent living. And this is just perfect, absolutely perfect for that person to make her even more independent in her life. That couldn't be better. Wonderful, thank you.
Any other members? Can't see anybody indicate. Councillor Claydon.
Yes, I'm just wondering about the extent of the staff retraining that you would need to do, because as you say, it's a very different care model than ones that we've seen traditionally, and what implications does that have for the authority as well?
Thank you. I think that, as you've rightly stated, this is a change for some people. For some staff work members, this is absolutely what they have been waiting for. They've had the opportunity. There are other staff members who have felt a little bit more hesitant, and we've worked with them around it is okay. It is okay to work differently. So it's not so much about an active training programme, although that is part of our ongoing work around supporting people with needs around behaviour, for example, in a positive way. That is part of our ongoing training. I think this is more around providing a different way of thinking and a different way of talking. And for most of our colleagues working across teams, they've needed it's a bit more of a mentorship, and it's a little bit more of an example and look how it's working, and it's more that than a defined training programme. I think going forward, we know that part of the work that we need to do is we may need to be supporting some of the individuals with more complex needs, and therefore we'll be looking again to see how our in-house team have the training in place to support people with increasingly complex needs, etc. But as a result of this piece of work, there isn't a specific training element. It's more around an ongoing development and conversations with the staff, with the workforce. Okay. So, sorry, Chair, may I just come back? Because I've focused primarily there on the direct care workforce. Of course, the other part of this is a social work element, because everybody that is supported has to have a social care assessment, and the progression model of working is absolutely one that we've got a progression team, and that progression approach of working is working through all of our social work practitioners. So as we've been sort of increasing this work, what we've actually done is we've identified those colleagues that perhaps have shown a particular interest in this type of work. We've worked with them first. They've worked with their, so it's been an organic process like that. So just to confirm from a social work element as well, that's how we've done it.
Ray?
I suppose for me, we've reflected this is a major change for all the right reasons. Often change brings nervousness and uncertainty for people. And I suppose my ask of you is your support as we move forward. If workforce or if residents and families, sometimes people could misperceive this as, well, it's the council trying to make cuts to save money. It's about, as Karen said, doing the right thing, delivering the right services in the right way, and we won't shy away from it. And that's more a cost-effective way of doing it. But as elected members, you've given a good example of there may be people in your wards that you will come across, maybe they be staff, parents, families, residents. It is about that. This is genuinely why we're trying to do this. We've won an award for it. It's about doing the right thing for people. And inevitably, it's just about how we support people through that change.
Councillor Richard Jones.
Yeah, thanks, Chair. Appreciate it. Could you tell us more about the award? Because it's quite interesting. I mean, we should applaud the awards that you get, because it's especially for something that says innovative progression model of support. I mean, because these things don't come along very often, do they?
So every year there's what's called the Social Care Wales accolades. Every authority is able to, under different categories, and you have to write a submission with an evidence base around why there's strong innovation and the outcomes and impact. They're particularly interested in impact and outcomes. What happens is people submit those. There's a judging panel. If the panel are interested and feel it's an area of note and something that the rest of Wales can learn from, there's then a judging panel that comes out and does a site visit. And in that site visit, they go out, they interview people, they establish for themselves actually that you meet the criteria, and they then reduce that to a final set of people who are shortlisted. And if you're shortlisted, they then send a film crew and you have to be filmed, and then there's an award ceremony. So it's got a lot of rigour to it. You have to have an evidence base to get an accolade, and there's only one in each category. So us getting that for this service is a real coup. And we did bring it to full council. I think it was a day when there was a lot of kids from a football club that came as well. So we do celebrate it, but actually for me, it's about what happens next after that award. And today is about how we're taking that forward and what we do next with it.
I don't see anyone else indicating, so we'll, Councillor Bibby.
Just to formally move the recommendations, Mr. Chair.
Thank you very much. So the recommendation is that members review the progression model of support and support the approach as the guiding framework for supported living accommodation for adults with a learning disability. So do I have a seconder for that? Councillor Claydon, and all those in favour? I think that's everybody. Thank you very much. We'll move on to agenda item 7, which is expanding in-house fostering service, and I'll pass over to Sarah Grant to introduce this.
Thank you, Chair. So in terms of Flintshire, I don't need to kind of talk in depth around the need for foster carers. We know nationally and locally there's a shortage. What I will say, though, is that in Flintshire, we are successfully running the Mockingbird project. Councillor Mackie knows all about that. He's been there from the very beginning. So in terms of where the purpose of presenting this report today, Flintshire, what we're doing at the moment is actively working to strengthen our local fostering service. We're going to be doing this through 3 key initiatives. The first one is expanding our Mockingbird project. The second one is the work stream around the Reconnect work, which I'm going to talk to you about shortly. And the third part is the expansion of our special guardianship order service. Just to give you some sort of facts and figures around this, Flintshire currently are exceeding their target with regards to special guardianship orders. So we are very, very strong in exiting our children from care through special guardianship orders. What we absolutely have to do is strengthen our support through the special guardianship order support plan, so that those families don't go into crisis and then end up coming back into our services. So hence the expansion of the Mockingbird, but then also with the special guardianship order support service. So I just wanted to give you some figures around that. So far this year, 13 have gone through the courts and have been approved, which is really, really positive. So in terms of expanding our Mockingbird project, you'll see in the appendices the progression report was completed with regards to the Mockingbird. I'm not going to go through all of that because you'll have had sight of it. But what you can see there in terms of the Flintshire numbers is that we have 34 satellite families, we have 3 hub homes, and we have 45 adults. 35 young people and 15 children of foster carers, all included in those hubs. They're very, very successful. Last night, just going off track a little bit, we had the celebration of the long service awards for the foster carers here at St David's in Eulo. It was really well attended. And I think the commitment that was shown there in terms of our foster carers and us actually celebrating that with them was really commendable. So I kind of want to put that in the context really of the work that's ongoing and the work that we want to expand. So in terms of next steps, what we're hoping to do, obviously after today, is a project plan is being put together at the moment with regards to what that's going to look like. Obviously, if we get this approved, in terms of how we're going to expand our 4th and 5th hub, because we're being very ambitious around that. We have secured the money through Welsh Government to be able to do that as part of the not-for-profit, and obviously bringing our children closer to home. So my fostering service are now working hard like the elves at Christmas to put together the project plan to be able to have a really clear timeline and targets about what we're trying to achieve. So that's where we're at in terms of our Mockingbird. In terms of the demand, because I think this is really important that you understand the current demand, whilst we're trying to stop our children coming in, we're also trying to exit our children safely where we can through the robust assessments, through all of the preventative work, but particularly when we're talking about special guardianship orders and safely exiting our children who have been in care, who can safely then stay with connected carers or special guardians. We've absolutely got to get that support right for them. And I can't stress that enough, because without that, these children are at risk of coming back into the system. And we don't want that. They've been through enough. So we absolutely need to see them settled. So I'm here today, obviously with my report, to hopefully get a recommendation that you are in agreement to expand our in-house general fostering households. We're able to support the implementation of the SLAIL initiative, which I will talk to you a little bit more about in my next report. It'll make more sense then in terms of what that's about, because the two are connected. And then obviously the support plan to increase the special guardianship service. I think currently our facts and figures around our carers, if we have 66 mainstream carers and we have 56 connected carers, we also have 7 families at the moment either in assessment or waiting to go to panel. So Flintshire are very proactive, and we have our marketing and recruitment team who are working really hard, who also put on a fabulous display last night and an event for all of our foster carers and children. So it's a very quick whistle-stop tour, but I know you will have seen the report and read the finer details. So if you've got any questions, please fire away.
Thank you, Sarah. Councillor Christine Jones.
Thank you, Deal, Chair. Yeah, just really quickly, they had the awards last night, fantastic. But we have our Pride of Flintshire Awards every year as well, celebrating our foster carers, our children who are looked after. And they're always so well attended, and the children, the families all get together for the day, all celebrate together, because they're like one big family, because they all know each other, especially the Mockingbird families. And it's so lovely for them all to get together on that one day and celebrate the achievements of the young people. So, you know, we do celebrate our children who are in care, and the foster carers and anybody connected care, everybody, and because we value them all so much, and we want to make them feel special, and because they are special and they do such a wonderful, amazing role for us. So just wanted to plug Pride of Flintshire, really.
Thank you, Councillor Jones. Councillor Mackie.
I just wondered, does everybody here know what an SGO is? Yes, yes, yes. I'll shut up then.
Yeah, it is in the it's in the glossary, I think, as well at the back. Yeah, just to say, I really welcome the proposed expansion of the Mockingbird model, and it's great to see that there's indicative funding in place for it as well. And I just think on the progression report as well, it's in the appendix. Yeah, there's some really good statistics and testimonies in there as well. So if anyone hasn't seen those, I'd recommend looking at the link in the appendix. Is anybody else? Councillor Claydon.
Yeah, I'd just like to highlight that as well. I think it says that you're the 3 times more stable Mockingbird families, and I think for those particular children, it is really vital that you have the most stable situation, because, as has been said, they've gone through a lot already. And I think this is, you know, the borrowing that went on and you know, the payback on it is absolutely worthwhile. And this it's a real spend to save, to make those children more secure, both at the time where they're in the foster families and in later life as well, I should think. So, yeah, I really do appreciate what's been going on.
I don't see any other members indicating, so we'll move to the recommendations. Councillor Bibby.
I'd like to formally move the recommendation.
Thank you, Councillor Bibby. Councillor Mackie to second. There are the 4 recommendations that are on the paper, so do I have ask members to vote all those in favour? That's everybody. Thank you very much. So with that, we'll move on to the final agenda item, which is Reconnect, supporting children to step down from out-of-county placements. And I'll hand back over to Sarah for this.
Okay, thank you, Chair. So again, this links to what we've just been talking about in terms of bringing our children, reducing our looked after children population, but bringing our children closer to home, so that they are linked to their communities, their schools and their extended families, where it's safe for them to remain in contact with their extended families. and also being able to reduce the costs, obviously, for our out-of-county budget, which Craig has spoken about earlier. So in terms of where we're up to with the development of the work, the Reconnect approach, you will have seen in the report, is in 3 phases. So this is all linked to the Welsh Government national priority to reduce the profit. We've spoken around that. In terms of this approach, we've developed a partnership with the Reconnect programme. It brings together ourselves and an intensive therapeutic approach for the children that we are working with. It's a bespoke programme, and it's very, very closely monitored. It's very closely, we're working very, very collaboratively with the service. The cohort of children that we identified were chosen very, very carefully from the very beginning. So these discussions took place from the very, very beginning, were very child focused. They were very sensitive discussions around the cohort of children that we could safely step down and look to progress, either to return to family or to step down into foster carers, into foster care placements, or actually bring them into, if residential care is still their right care plan, actually bring them into a residential placement closer to home, to their community, that is actually more cost effective. So those are the 3 areas that are being looked at and worked through with the Reconnect project. I think just in terms of, to give you some context really of the current level of demand that we have, and I think this will just help set the scene a little bit for you. Our demand at the front door at the moment has increased. Okay, and I'm giving you this context because I think you need to kind of understand that whilst we're trying to safely exit these children in a very safe way, we're also experiencing a lot of demand at the front door. So our contacts have gone up at the front door in the last quarter. Our assessments have gone up in the last quarter. Our care and support plans, our direct payments, our looked after children has gone up. Okay, so I think we have to kind of understand that's what we're dealing with at the same time as we're trying to work through and safely exit our children using the support from the project. In terms of the phases, there's 3 phases. The first phase is very much, well, it's all in the report. The first phase is very much around identifying the children. The second phase is around the assessment. And then obviously the third phase is where you start to look at the assessment and the matching with foster carers and actually moving the children through. Currently, the work that's ongoing with Reconnect at the moment, I can give you some figures around this. We have 17 children currently that we are working with in phase 3 with the Reconnect programme. 2 children have already successfully moved. So now we are looking at how we maintain and sustain the stability for those children. We had some children that exited the programme at the beginning. We identified a cohort of 21, but we had some children we had to exit because it just wasn't the right time for them. And this needs to be really child focused. And I have been very clear about that from the beginning. The children have come from trauma backgrounds and everything that we know, and we have to be trauma informed in the way that we deal with the progression of this. So we're currently, as I say, working with 17 children and 2 have successfully moved. In terms of all of the other work that's ongoing, we are working really hard to try and prevent our children coming in. Obviously, our numbers aren't stable, they're not, but we've got some really, really good work going on at the front door in terms of all our preventative and early intervention services. So you need to see that in the context of the tap. We're trying to slow the tap down at the front door, in addition to working with Reconnect at the other end to try and safely exit this cohort of children safely. Is there anything? Sorry, I need to put my glasses on here. In terms of what I'm asking for today, in terms of bringing this report today, I'm asking for you today to actually approve and consider and approve the ongoing work that we are doing with Reconnect, because obviously if the work that's ongoing right now, those children are already in the cohort, and they are the assessment and a therapeutic intervention that those children are going through right now is underway. And at the same time, what Reconnect are doing is helping us to expand our in-house foster carers. So whilst they are also helping us to employ and recruit foster carers, we have also successfully had 4 of our in-house foster carers that have stepped up to want to be matched with some of these more complex children. So that's really, really positive, because the Reconnect project are then helping us to backfill with those foster carers. They have a database and access to a database that we don't have, that actually enables them to, it's a market tool for them to be able to recruit. So they have some strong leads at the moment that we are, they're connecting with. And obviously all of this work is ongoing. There's weekly meetings, a lot of scrutiny over it, and it's very child-led. I was just conscious Craig was there and I felt like he wanted to come in. So I guess in terms of what I'm asking for today is for you to kind of approve this ongoing work that we've started, and recognise the children and the progress that's been made so far with the cohort of 17 children. There is a potential annualised savings for this work, and these figures at the moment stand at 3,450,587. So that is the annualised savings projected for the work that we are doing. Again, I just want to reiterate, though, we are dealing with children here, and we're dealing with children's lives, and we have to have the sensitivity wrapped around that in terms of next steps for them. Okay, thank you. Any questions?
Thank you, Sarah. I'll open up to members now. I'm not sure we've got any questions, though. It's a testament to how thoroughly you've introduced the report, Sarah. In that case, unless anybody does want to come in, we'll move the recommendations, or I'll look for somebody to move the recommendation. Councillor Buckley, are you moving the recommendation? Thank you. And Councillor Claydon to second. All those in favour? Everybody? Thank you very much. And that was the final agenda item. So, Dioff, thank you all very much. That was very productive. And I will see you all now, well, in this setting, in 2026. 15th of January, I think our meeting is. So, Merry Christmas and Dolly Clowen to you all. Happy New Year when it comes. Can I close the meeting?